back the curtain on a huge, often hidden problem in medicine, and, more importantly, we'll see how some amazing new tech is stepping up to solve it.
Just think about that for a second. You get told you have Parkinsonism, you're being sent to a neurosurgeon, and then, poof, it's all rendered moot, it's all unnecessary. This one sentence, right from the source material, is the bombshell at the center of a story that honestly could have ended up so differently.
So you gotta be asking, right? What in the world solved this terrifying diagnosis in just 4 days? What was the magic bullet? Well, that's the medical mystery we're gonna unravel together. And believe me, the answer is somehow both way simpler and way more complicated than you'd ever guess.
All right, so to really get the solution, we have to start with the person at the center of all this. Let's look at the terrifying situation they were facing.
So here's the setup. We have a 70-year-old patient who's dealing with a persistent tremor. They go to the doctor, and after an evaluation, they get hit with this diagnosis: Parkinsonism. That's a condition with symptoms that look a lot like Parkinson's disease. And the very next step, they're told they need to see a neurosurgeon. I mean, can you imagine? For this patient, for their family, this is just a terrifying world-stopping moment.
But here's the twist. The real story here isn't actually about a new, scary neurodegenerative disease. No, it's about something way more common, something that's often hiding in plain sight in modern medicine. That incredibly complex web of medications that so many of us are taking every single day.
Turns out, this patient was on 8 different medications. 8, all at the same time, for different heart and metabolic issues. Now, that number alone creates this invisible jungle of complexity. For any doctor trying to track all the possible ways these drugs could be interacting with each other, well, it's a huge challenge. And this whole situation really boils down to 2 key ideas you need to know. First, there's polypharmacy. It's a fancy word, but it just means being on a bunch of different drugs at the same time. But the second one, that's the real kicker here: attribution error. This is when a side effect from a drug gets mistaken for a symptom of a totally new disease, and that is where our medical mystery really gets started.
You see, the real danger was hiding in the interactions between these drugs. The clues were there, just buried in the patient's chart. For instance, one of the heart medications, Amiodarone, can mess with beta blockers, but it can also crank up the levels of another drug, Theophylline, which is known to cause tremors. See where this is going? The patient's so-called Parkinsonism, it wasn't a new disease at all. It was just a signal getting lost in all that chemical noise.
Okay, so with all this complicated stuff going on, how did they actually figure it out? This is the turning point. This is the aha moment that changed absolutely everything.
And you won't believe how simple the solution was. After that big, scary diagnosis, one clinician made one tiny change. They just cut the dose of that one heart medication, Amiodarone, in half. That's it. And just 4 days later, the tremor, the one that got them a referral to a neurosurgeon, was completely, totally gone.
4 days. That is all it took. Think about that. 4 days to completely undo a life-changing diagnosis, just by pulling the right lever. It's this incredible moment of clarity that proves, without a doubt, that the first diagnosis was just wrong. You know, in the medical world, they have a name for this. It's called a Dechallenge signal. It's pretty straightforward. When you lower or stop a medication and the symptom just vanishes, that's super strong proof that the drug was the culprit all along. This was never Parkinsonism. It was a textbook case of a drug-induced tremor.
So this particular case got solved, which is amazing. But it really depended on one sharp clinician making the right call. That brings up a much bigger question, right? How do we build a system that can catch these things every single time so that a patient's health doesn't just come down to a roll of the dice?
And the whole philosophy behind the solution is wrapped up perfectly in this quote. Human in the loop isn't just some catchy slogan. It's an absolute requirement for safety. The goal here is not to replace doctors with AI. No way. It's about building tools that work with them, keeping that human expert right where they belong, in charge. So let's be super clear about this. This is not about technology that comes in and replaces a doctor. Not at all. It's about technology that augments them. Think of it like a safety co-pilot for your doctor. It can crunch all the complex data, spot those hidden signals we talked about, and then present the options to the human expert who makes the final call. Okay, so what does this safety co-pilot actually look like in practice? Let's break down how a layer of software can create this, digital safety net.
The whole process is actually pretty straightforward. First, the app pulls in all the patient's data,
Their meds, their lab results, their symptoms, the whole shebang. Second, its powerful engine starts hunting for those causal signals, right? Like, hey, this new symptom popped up right after this new drug was started. Third, it generates a list of possible explanations or hypotheses. And finally, and this is the key part, it suggests simple, safe trials of change for the doctor to consider, exactly like that dose reduction that solved our mystery.
And what's so important here is that this is not some kind of mysterious AI black box. The whole system is built to be totally transparent. For every single suggestion it makes, it shows its work. It lays out the evidence, it explains the clinical reasoning. This is how you build trust and give the doctor the power to make a really confident, well-informed decision.
So when you step back, the impact of a system like this is it's huge. This isn't just about helping one patient, it's about building a fundamentally safer healthcare system for all of us.
What you end up with is a system where everybody wins. For patients, you get answers faster, and they're the right answers. For doctors, you get this amazing tool that takes some of the pressure off and helps them connect the dots. And for the whole healthcare system, well, you save a ton of money by not going down the wrong path with unnecessary tests and scary procedures.
So when you boil it all down, this is what it delivers. Fewer wild goose chases, diagnostically speaking. A much faster time to feeling better, which means less worry for patients and their families. It means safer prescribing for millions of people. And yeah, at the end of the day, a lower cost of care for everybody involved.
And that really brings us back to the core idea, doesn't it? This story, it had a happy ending, but it so easily could have gone the other way. What if finding the right answer didn't have to come down to luck? This technology points to a future where solving these complex medical puzzles isn't about a lucky break, but about having a system that's designed for safety and for clarity right from the very beginning.